The 6 members of the Joint Centers for Transformative Healthcare Innovation have a history of being places where practical, doable, and realizable new ideas get developed, nurtured, and implemented. And by sharing these ideas, we are accelerating the spread of innovation across a broad section of the healthcare system. Here are some of the infectious ideas spreading amongst the Joint Centers right now.
We're very proud of our ability over the last number of years to reduce our C-section rate from a little over 29% down to almost 22%. We've done this by using data that's shared widely amongst all of the caregivers within the obstetrical area, and by making sure our approaches are evidence-based. Through our data, we were able to find areas of improvement. Some of those areas include increasing our vaginal birth after cesarean section, or VBAC rate, by reducing our induction rate from 30% down to less than 15%. That had a tremendous impact on reducing our overall cesarean section rate as well. If we can reduce our cesarean section rates, it helps with getting mothers mobile faster following their delivery, getting them home sooner. It diminishes the amount of pain they have afterwards. It's certainly, by preventing that very first cesarean section from occurring, pretty well guarantees them of having a vaginal delivery that second and or third going on. So tremendous benefit as far as patients go, and that's what it's all about.
By examining our data collaboratively, applying the Robson's criteria for the indication of cesarean section, and developing peer review processes, we have identified opportunities for improvement. We are developing new checklists and processes to guide decisions around appropriateness of induction of labor. As we learn that women who are pregnant for the first time and are induced have higher cesarean section rate compared to similar women who are in spontaneous labor. We are also developing teaching materials to guide women choosing vaginal delivery after previous cesarean section.
Choosing wisely, the whole initiative behind it is for patients to have a conversation with their doctor around what it is that they really need, what tests they need, what procedures they need, what operations they need, so that we can tell them, you know what, you don't necessarily really need an MRI, or maybe you don't need a CT scan to be exposed to that radiation. Maybe an ultrasound would actually be better and provide the same information with less radiation, for example. Maybe you don't need to have a blood test. Maybe all you need is to have a conversation with your doctor so that they can choose wisely with their physician in terms of these procedures and tests. It's been really amazing, some of the achievements that we've been able to gain through this initiative. For example, in our emergency department, after instituting some of the changes that we made as a result of choosing wisely, we've decreased the number of blood tests in the emergency department by 40%. So again, just asking some questions and thinking about things in a slightly different way changed the whole paradigm in our clinic and resulted in fewer tests being done and better care for patients.
Choosing Wisely is an initiative where we ensure the appropriate diagnostic testing for patients. Basically, what we're looking to do is to make sure that we do the right test for the right patient.
In addition, it has been a catalyst for us to engage our communities in practice in redesigning how we provide care and how we improve care over time.
I think the most important element is engagement of physicians in the various institutions. They are the ones that are meeting with the patients and having the communication and dialogue with them, and they are the ones who are ordering the tests.
The innovation will eventually lead to improved dialogue between the physicians and support services to ensure optimal patient care. As new tests become available in laboratory medicine, the process for responsive change will be set.
Nationally recognized for its commitment to patient safety and quality patient care, Mackenzie Health has embarked on a journey to decrease our Clostridium difficile infection rates. Inspired by Toronto East General Hospital's multi-pronged infection prevention and control approach, we have been re-evaluating our approaches and have had successes over the past year. We started using Clorox in most inpatient units and the emergency department. We have also been working with staff to ensure that Clorox is being used most effectively. This includes in-services, online training, and hands-on retraining with environmental services staff. We have also reviewed our environmental cleaning standards and have made adjustments to our ATP testing thresholds. We are also excited to be piloting UV light technology to enhance our cleaning and disinfection process. We are currently undergoing a feasibility study to determine the parameters for our pilot testing, expected to begin in the spring. The opportunity to share resources and experience has been extremely valuable in guiding our improvement initiatives.
At Southlake, we are always looking at better ways to keeping our patients safe. At last year's InnovationEx, we took interest in Toronto East General's methodology to decrease C. difficile infections. We too have taken extra measures to help reduce our C. difficile rates. These include antimicrobial stewardship and a great focus on hand hygiene from the top down.
Innovative ideas like the use of UV technology at Toronto East General sparked us to look at other technologies such as no-co spray. No-co spray is a touchless disinfector that allows us to get in all sorts of areas that we can't mechanically. We're also expanding the use of bleach for disinfection and also looking at ATP testing for quality.
There are plenty of good ideas like these in healthcare, and many people with the courage to do things differently. But it is our willingness to share that is driving change. Together, the Joint Centers are making innovation infectious and spreading ideas that are transforming healthcare. Innovation happens here.